just want to invite you to listen to some of the things that may help you following hip surgery and how you can heal the best way and fastest. First of all, you want to follow all the doctor's orders. Don't skip anything. Don't think, I feel good, I'm going to walk 2 miles today. Do not do that. So you may be outpatient coming home. You may be overnight coming home. They're going to prescribe some opioids. It could be hydrocodone, could be OxyContin, Tramadol. Follow the directions on what they say to give you. You can offset that with Advil or extra strength Tylenol if it's not, if it's wearing down a little bit. But you want to get off those opioids by day 4. Now they're going to give you enough opioids to cover at least a month or 2. You need to get off them on day 4 and go to Advil or Tylenol, even though you're in great pain, because after day 4 into day 5, you now are in the addiction zone. And if you continue taking the opioids until they run out, which is a month or 2, you will be addicted to opioids, and you don't want that. So it may be day 5 and 6 and 7, yeah, you'll be in pain, but your body's healing and you can feel it getting better. So I would, after day 4, kick in with the Advil and extra strength Tylenol. A little note about if you are a THC user, you do not want to use THC until at least week 3 because it will enhance the pain. It'll make the pain worse. So just a side note, that won't be on any doctor's orders for obvious reasons, but do not do THC until after 3 weeks. And don't do THC before, and don't do alcohol before, and don't do alcohol after. It's going to only enhance your pain, and you don't want that. So here's a short recovery timeline that I experienced. Everybody's different because everybody's in a different shape, age, whatnot, prior to surgery. So the main thing is you do not want to fall. You do not want to put yourself in any situation where you're going to fall, and the doctors will enhance that. So you're going to have to sleep on your back. You can put your knees up, knees flat, but you'll have to sleep on your back for at least the first 2 weeks. You will get very little sleep. That's all right. You still will be healing. You're only going to get about 2 hours of sleep at a time, almost like if you're a mom when you had a small child. You want to drink a lot of water. You will be going to the bathroom a lot, but every time you get up and you're moving your leg, that's good. It's healing. Use your walker to move around the first couple weeks. Do not bend over to pick up anything. I recommend getting a hip kit or a little a stick with some pinchers on it that you can just pick up things and you don't have to bend over. Do not bend over. You can bathe after, I believe, about 7 days. You'll have bandages on, and the doctor will give you orders on that. If the bandage gets wet, first of all, you don't want to bathe prior to 7 days, but if you keep it on and the bandage gets wet, you need to take it off after you take the shower. But you can take a full shower after 7 days. You have to be very careful in the shower. Make sure you have grab bars or something to hold on to. I recommend having a spouse, a friend, or boyfriend, girlfriend, somebody, daughter, son nearby, just in case you feel unsteady. Week 2, you're going to use your walker to walk around the house. Not going outside yet, not doing a whole lot of stairs. I recommend do not do stairs the first 2 weeks. Try to stay on one level. This is the time when you have people to go get things for you. And if it's something you think you're going to need in the first 2 weeks, have it set up on the first level or that you're going to be at. Week 2, you're going to probably have a home health nurse. Sometimes they come in, sometimes you have to go to them, and they're going to start physical therapy. Every doctor's a little bit different on what he or she orders, but you definitely want to start the physical therapy by no later than week 2, and they'll be giving you exercises to do on your hip. You need to follow them and do them. Don't say, I don't feel like it. Don't say it hurts. You need to follow them. Week 3, you're still going to be walking around in your house, but you'll be able to go maybe a little bit faster, go into more rooms. Probably not going to go outside. You might go out on a porch if it's at the same level. Once again, do not bend down and do not put yourself in a situation where you're going to fall over. Week 4, that's when your pain really subsides. That's what I felt. And I felt like, oh, a big relief. My pain is subsiding. I started to not use the walker as much and started to go to a cane, but not full time. Um, just do what you can. You might feel like, oh, I don't have the pain, I can walk. Although do not push yourself. You're just going to walk around the house, walk on a deck. That's about it. So week 5, you're going to definitely be transitioning from the walker to the cane. And you can bend slightly at the knee, but you're not going to bend from the waist. You bend at the knee if you need to pick up something, and then you pick it up. Also by week 4 and 5, if you need to use THC to sleep, which I did because I need to catch up on that sleep, which I was missing the first 2 weeks, definitely use THC if you need to. But nothing else. No alcohol, nothing stronger than THC, would I recommend. Week 6, you're going to transition to walking without the cane. So you can walk outside, walk around a short block. Do not walk a mile, walk maybe a half a mile at the most. Even though you feel like walking more. I had somebody like, oh, I feel great, and this person was a runner and whatnot. Then they walked on week 5, I think it was, they walked 2 miles. Well, that set the person back in his recovery. So even though you want to get out and walk and go to the store and do all this, take it easy. Depending on your doctor's orders, you may be able to drive, depending on what leg the surgery was on. And whatever they say, go ahead, drive. Definitely by week 5 or 6, you can probably drive. By week 6, your hospital schedule physical therapy is probably concluded. I recommend, once again, based on your insurance, to pick up a local physical therapist that you feel comfortable with, and that person can work on building more strength in your leg where the hip surgery was done. And I stayed with that additional physical therapist for up until like week 8, week 9. Week 7, you can increase your walking without a cane. By week 7, you should not be on a cane. And I did like about a half a mile on week 7. I just took it easy. I wasn't going to do anything. On week 7, yay, you can sleep on your side now. You don't have to sleep on your back. That was a big break. You can also move your legs over top of one another so that by week 7, you shouldn't have a whole lot of pain. Week 8, you can do stairs. I did the elliptical by week 8. And then week 9, 9 through 12, you should be good once again. Don't overdo it. You're just building up your endurance day by day, week by week. Do not walk 2, 3, 4 miles. Do not run yet. By week 12, your hip should be healed. And you should have little to no pain by week 12. And by week 12, then you can go to the gym and do your workouts and do your running. The main point during your recovery is you cannot fall. If you fall, it's disaster. You may end up in a wheelchair for the rest of your life. I don't want to scare you, but that could happen. So anyway, thanks for listening. I hope your recovery with your hip surgery went as well as mine. Follow the directions.